Hello, my name is Randy Gagnon, also known as Gogs. In this video, I want to talk about the prostate biopsy that missed my massive tumor. In my previous video, the PSA blood test controversy, I mentioned that I had a prostate cancer tumor the size of 2.5 golf balls, and yet a prostate biopsy completely missed it. Now, before I talk about why it missed it, I want to talk about what is a prostate biopsy and why is it even necessary. A prostate biopsy is where a doctor will take tissue samples from your prostate and examine them under a microscope and compare the prostate cell tissues to normal looking prostate cell tissues, and will assign a Gleason score, which is kind of a grading, to determine how far or how close your prostate cells look towards a normal looking prostate cancer cell. And the Gleason score, you would think, would be, because it's a range, you would think they would use something like 1 to 5 or 1 to 10 or something. But no, they use something a little bit more complicated, but it kind of makes sense. And what they do is, if your prostate cells look like normal healthy prostate cells, then they don't get a Gleason score at all, and that's what you're looking for. Now, if your cells look a little abnormal, the more abnormal they look, then the higher the Gleason score will be. And what they do is they look at all the cells and compare all of them, so it's very meticulous work. And they will say, well, maybe some of them look a little bit more abnormal than others. So they'll group them into two groups. They'll say, well, you mostly have some that are abnormal, but not that abnormal. And you'll have only just a few that are abnormal that are pretty abnormal. And they'll start off by saying a 3, a Gleason score 3. And a lot of doctors will consider a 3 not even cancerous or perhaps precancerous. And then from there it'll go up to a 4 and a 5. And because they grade it twice, or there's two gradings, the first one will be what the most cells of that characteristic will have the first grading, and the ones that the least amount of cells will get the second grading. So, for example, you might have a 4 plus 3, meaning most of the cells are a 4 and some of them are a 3. Or if it was a 3 plus 4, that means most of the cells are a 3 and some of them are a 4. And then it goes up from there, 4 plus 4, and then 5 plus 5 is the worst. Now, why is it necessary? Well, prostate biopsy is really the only way that a doctor can confirm what your prostate cells look like. So even though you may have a tumor, or maybe you have some rough spots, or maybe in my digital rectal exam video, I talked about the doctor's feeling for any abnormalities, soft spots, hard parts, hard areas, things like that. Just because you have all those things doesn't necessarily mean anything other than perhaps some other benign condition. And the only way to really know is to have the prostate biopsy. Now, what is a prostate biopsy, or how is the procedure? What is it? How is it that they actually do it? Well, they have what they call a biopsy gun, prostate biopsy gun, that is spring-loaded, and it has a hollow needle that's loaded into the chamber and has a trigger. And they'll insert this gun into the rectum, and they'll aim it against the the rectal wall towards where the prostate is, and then pull the trigger. And I was warned when I had my prostate biopsy that that trigger makes a loud noise, and it sure does make a loud noise, so loud that I jumped even though I was warned. So they'll line it up, pull the trigger, bang, the spring goes flying and shoots that hollow needle right through the rectal wall into the prostate, and then pulls it back and pulls a core set of tissue samples out, which can be examined later under the microscope. Now, is this a painful procedure? Yes and no. I didn't have any painkillers or anything like that, sedation. It just, I went, and I had 6 tissue samples taken, and the first one I didn't feel it at all. And maybe that's because I was surprised by how loud the gun was that I didn't feel the pain. But I felt the second one. It was quite painful. And the third one I don't think I felt. But the fifth one, the doctor even warned me. He said, you might feel this one. And I'm like, well, okay, bang, and holy smokes, the pain was off the radar. But the interesting thing was the pain was gone within a split second. It was like a 12 to a 0. And I went, well, that's odd. Now, after the procedure, what can you expect? Well, for me, there was still pain in my rectum for several weeks. There was bleeding, not only through the rectum, but there was bleeding in the bladder, or blood in the bladder. And I was warned that you would be peeing blood, and don't worry about it. But I was it was recommended that I drink a lot of water, which I did. Drink a lot of water to kind of flush the bladder out and get all that blood out. But I do admit it is a little disturbing to see yourself peeing blood. And then I had that prostate biopsy. Now, I didn't realize at the time that it was a blind biopsy, meaning I didn't have an MRI, they didn't have a target. They were basically taking random samples, tissue samples from my prostate, where cancer was most likely to be found. And what had happened is they took these 6 core samples, went through the whole procedure under the microscope, did all the grading, and came back, all my cells normal, no cancer. Now, I assumed at that point, when I got the news that there was no cancer, I assumed there was no cancer. But what that really means is, when they say no cancer, it means no cancer found in the samples. But yet I had this massive tumor that they didn't know about. So I went on my day. I was so happy. Hey, no cancer. So, good thing there. And however, my PSA continued to rise. So another, good example of why the PSA test, potentially is a good measurement to take over a period of time to see what's happening. Is it staying stable? Is it going up? What's happening with it? Mine kept going up, even though I had a negative prostate biopsy, and it kept going up for years. And I saw my doctor, saw my urologist, and they just kept on checking my prostate through the digital rectal exam every once in a while. And they did another blood test, and it was like every 3 months or so. And that went on for a few years. So basically, it got to a level where they were getting a little concerned, saying, wow, this is still rising, and we have no idea why. So they said, this time we do want to do another prostate biopsy, but we're going to send you for an MRI first. And I'm like, MRI first? Why didn't we do that the first time? Anyway, had the MRI, and holy smokes, the image that came back identified a significant anomaly. Not just a little anomaly, significant. Size of 2.5 golf balls. Some is going on in that area. So there I was sent off to another prostate biopsy. Oh, and one thing I neglected to mention, before you have the prostate biopsy, you'll be given antibiotics, and that is because to help prevent any infections that may happen with the prostate gun going in there and everything, and the needle. So you have like a 7-day supply of antibiotics that you take a little bit before and afterwards, kind of thing. So I went for my second one, and this time, under the results, came back as, yes, we have found cancer in all 6 cores, and they all came back with the same grade, which was a 4 plus 3 equals 7. 4 meaning most of my cancer that was found was a level 4, where some of it was only level 3. And in the samples itself, over 70% of the cells in those samples were cancerous, the 4 plus 3. So then I got the news that I had cancer, and then of course that's when I kind of shut down and panicked a bit and thought, well, let's get rid of it. And that's something that I want to talk about on my next video, which is going to be the how not to make a decision. And a little preview there is, it's not a good idea to make decisions of any kind, especially when it comes to your health, especially when it comes to life-altering decisions. Do not make those decisions while you are in shock. Please give yourself enough time to absorb and to understand the gravity of the situation, and to sit back and breathe and make sure that you're thinking of clear mind before you rush into any particular situation, or at least if you do have to kind of speed things along, that you're feeling comfortable and you understand what you're getting yourself into, and you understand that that's something that you want to proceed with. Very personal decision. Every case is different. A lot of things to consider: your general health, your age, your how far the cancer has invaded, what the Gleason Score is, what your PSA, do you have any other health issues? A lot of things to consider, very personal, and also what your personal thoughts and opinions are, all to be taken into consideration when it comes to making a decision. Just give you a little preview of another video that I'm going to do is my dad's unexpected prostate cancer diagnosis. I was diagnosed with prostate cancer first, and 2 years later my dad was diagnosed with prostate cancer, which is really odd. Usually the father first, then the son. Because of his age, he was 86 at the time, and his cancer was even more aggressive than mine. Gleason score 4 + 4 = 8, and his PSA was like 300. Because of his age, and he felt he lived a good life and everything, he didn't want to do any treatment of any kind. He just wanted to ride it out. And we'll talk about that anyway. It really depends on a lot of factors. It's personal decision. Okay, well that pretty much wraps up my prostate biopsy that missed my massive tumor. Had I known better, I would have, for that first prostate biopsy, I would have asked the question, what about an MRI? Now, I don't know if it's because of the cost of an MRI, what kind of insurance you have, things like that. But ideally, when you have someone shooting a spring-loaded gun through your rectum, through the rectal wall, into your prostate, you kind of want to make sure that they're actually aiming at a specific target rather than just taking random samplings. Now, mind you, most cancer does grow or develop in the area where random samplings are taken. So in most cases, random sampling will find the cancer, and it saves you from an MRI, I suppose. But in my case, a bit more rare, my tumor was actually developing on the other side of the prostate, where it's out of reach of the digital rectal exam, as I mentioned in that video, and also wasn't where cancer was likely to grow. Okay, well, once again, thank you so much for watching, and I appreciate your time. And please subscribe, spread the word, and help rebuild my channel. And please comment, please hit the like button if you found value. And any comment at all, any questions, I'm happy to answer. I'm here, and I appreciate it very much. Okay, have a awesome day, and talk again soon. Okay, awesome. Bye-bye.